Cataract always poses a challenge to all of us. And you see, if the pupil is small, it's difficult for everything. Even it's difficult to read what's written there. So similarly, same thing we feel there while doing the cataract surgery. So a small pupil with hard cataract is a typical challenging situation. Now thankfully there are devices we can expand the pupil and do is as routine case normally we used to do with the cataract surgery. So non-dilating or poorly dilating pupil poses a lot of challenges. There is a reduced surgical space because we have to make a small access also in these cases. There is a reduced surgical access, difficult in manipulations, higher chances of trauma to rhexis, capsular bag, anterior capsule, tear, posterior capsule. They may be tear in the posterior capsule, more common in these cases. Iris touch is not uncommon in these cases. And it causes prostaglandin release, thereby further constriction of the pupil. Trauma to iris can lead to chafing, can sphincter tear, there may be iridodialysis, there may be hyphema, there may be PCR. And because of this constricted pupil may have retained cortical matter. One optic of the IOL may be in the sulcus, one may be in the bag. We are not sure where it is because we can't see properly. Increased postoperative inflammation, corneal edema and CME. So what is a small pupil? Basically, what size should be called small? Is it a 2 millimeter? Is it 3 millimeter? Is it 4 millimeter? I think the pupillary small size is related to surgeon's skill. A good surgeon can do even a smaller pupil, but a novice surgeon has to have a very big pupil to do it. And intraoperative situation, what are there? It's a floppy iris, or if there is a posterior synechia, or is there pseudo exfoliation. Then the properties of iris tissue and the pupil. So surgeon's skill and technique if we talk. So first we have to use pharmacological agents like phenylephrine, topicamaride, cyclopentolate, NSAIDs. And if doesn't help, then we can use viscomydriasis. Hilon 5 is particularly good, or we can use soft shell technique. It provides a dilatation up to some extent. Only thing, you have to do repeated filling it, otherwise the effect goes off. Then pupil stretching. If you have to use any device, it's better to use stretching. There are two types of pupil. One is the elastic pupil. They may expand themselves once you stretch them. But rigid pupil may break. They may cause tear, chafing and everything. So before putting any, even iris hook or insertion, any ring, you have to stretch them well. Stretch so that they can be relaxed and there may not be much of the problem for putting pupillary expander in these things. Second, we have to reduce our parameters and we have to use chopping technique more so as to not to go into the periphery, and we have to restrict manipulation to the pupillary center. Bimanual IA is more helpful once you have to remove the peripheral cortex. It's become much easier with the bimanual method. Then coming to the hooks and rings. So hooks are very cheap, easy to use, and only thing they have a lot of problems. I'll not go in details of this, but to start with, you can start with a pupillary hook. Most of these causes some stretching on the pupillary margin. You got a disturbed pupil, and some of the problems sometimes prolapse may be there. Now, fortunately, we have got a lot of pupillary expander. There are new devices which are coming, which are much safe, and in fact, they are getting cheaper also. You can use in these cases. Like this is one. It's a S-shaped pupillary expander. It's like a scissor. You put it and expand it. So we have to make apposite 19 gauge paracentesis placed 90 degree to the main wound. It gives us a good 6 millimeter exposure. So this is a small video. Just look at thoroughly, you'll see how easy it becomes to dilate the pupil. So we make a very small incision, 0.9 millimeter, and these are scissor-like hooks. This can stab the pupil easily, one on this side and second on this side. So you require a little practice, but it can be easily mastered. And you get a nice rectangular area and you can do so your surgery easily. Then manual ring is probably one of the most popular ring available now internationally. It's the latest version is 2.0 that can go through 2 millimeter incision. It's a very thin material, 5.0 propylene. It has got 8-point fixation. We require high viscosity OVD, preferably the Helon 5 in these cases. This, as you can see, is a very smooth one. So you had to grasp one, load it, easy to load. And put it and try to stretch the upper one or the 6 o'clock, whatever you place it. Most of the time the peripheral ones also get one. You are left with the last one to deal with. Stretch it, center it, and you get a nice space to do your cataract surgery. Again, animation. Now we have got another device like eye ring pupil expander. It's a circular soft ring made of polyurethane. You get a nice 6.3 millimeter circular exposure. That's probably the biggest you can get. Again, almost they are similar, only thing their orientation is a little different. This is marketed by BVI. So basically you have to stretch the pupil atraumatically, that's the most important thing. Use plenty of visco, but don't overfill it. That's again an important point. If you put it overfill, then the iris get pressed, then you will find too difficult it. So keep your visco not too much, that makes the insertion much easier. That's a very important tip for this. Almost all the pupillary expander for that matter. And taking it out is again very easy. Just the same injector, you can put it, it will go through a side port. So what we got in India that's very popular, done by our colleague Dr. Suven Bhattacharjee, is the BX pupillary expander. It's a flexible hexagonal plastic, that's a polyamide ring. It's just 75 micron thick, very thin profile, and it's a uniplanar in design. It can go through 1 millimeter incision. So that's very easy to put through side port only. And most of the ring you have to put from the main port, but it can be very easily put there. And you have to have a 23 gauge micro forceps with this, and you get a nice 5.5 millimeter exposure. So it's a very simple uniplanar design. We have got a 6 flanks, 6 notches, and we have to put alternate one up and down like this. Very flexible. And it's available at the fraction of cost what you could pay for million ring. So you get a nice hexagonal pupil, and you can do all the procedure required, then you can just simply stretch it out. And now you can see we can take it out even from 1 millimeter incision now. So the beauty of these is you hardly traumatize your pupillary margin. Your pupil is normal on the next day. There may be some inflammation, so you have to give some NSAIDs in these cases, you have to remember that. So these are the few benefits: easy insertion and removal, very small incision required, is useful in anterior chamber, there is no clouding there. Hexagonal shape is much more convenient to do. So with this, before ending my talk, I would like to say now we have got the rings from Indian market. Arora has come up with the new, that's the injectable one. It's come preloaded. I haven't tried it. Then one is coming from Madhu also, Madhu Instruments. So I haven't tried it, but these are good designs, and probably these are much cheaper also. And they may be main thing, because why we are using iris hooks? Because they are cheap. But now we are getting cheaper rings, which can be used in most of the cases. Thank you very much.
Thank you, Dr. Vinod Arora, for the wonderful presentation of small pupil management with different kind of expanders. A very simple question, like if you have a situation of a small pupil, would you prefer the hooks, iris hooks, or the expanders?
Pardon?
Or the expanders?
Expanders are much better in any condition. In any condition, expanders are much better. They are much least traumatic. They give you regular pupil, and it's much easier to use. Till now, the cost was the only factor. Otherwise, I think they are much better.
Right. Dr. Bhati, you have comment on this?
Actually, looking at surgeons' comfort, their own advantages, their disadvantages of a hook is that you have to make so many ports to put so many hooks, like you're putting 4 or 5, which expander can be done through a port which is already existing. And the other factor is what is damaging the pupillary dilator or constrictor muscles more. So that is also, it depends. The expander is sometimes it is not damaging the iris muscles at all, and that is why the pupil comes back to its normal size, where the hooks may damage the pupillary constrictor muscles, and that can keep the pupil enlarged at a later point in time. But compared to expander, the iris hooks are much easier to use. So if you are wanting a situation where you want to do everything very easily, then the hooks are much easy, and they are easier, and also removal is also pretty easy as compared to the expander. So if you are a surgeon who has got a lot of experience, then I think expander, but otherwise you can start with the pupillary hooks, and then probably later on you can graduate to expander.
Agree, sir. I think for the beginners, I think hook is much easier because it has a learning curve.
Yeah.
Whatever ring you are using, it has a learning curve. Once you are comfortable with hooks, then it becomes much easier to adopt to ring.
Correct. That is what I said.
I think the message is very clear. Once you are starting, it's better to start with hooks. The other advantage is the time taken with the ring is much less. If you have to put a hooks, it takes a lot of times. Not only you make a holes, it takes time also to do with it. So you save on that thing. But it's better to learn first hooks and then switch over to ring. Thank you, sir.